Hello, during this presentation, I'm going to discuss the HIV/AIDS epidemic in the United States, Germany, and Haiti, and how each country's individual healthcare systems affects this disease. Luckily, all three countries have seen decreases in HIV-positive infections in recent years, and hopefully this will continue. The Quad model is used in the US, meaning there's a limited government role, with the government having plans like Medicare and Medicaid. Other than that, most US citizens either have insurance through an employer or buy their own private insurance. When the Affordable Care Act was passed, there was an individual mandate that required all US citizens to have insurance. But the penalty for that requirement has decreased due to the Trump administration. The US healthcare system is also more based on acute care, not prevention, and is high on cost but average on outcome. The US has the most expensive healthcare in the world and uses 17.8% of their GDP spending per capita. On average, other countries usually spend around 15. In the United States, there are 1.2 million people living with HIV, although 13% of people don't know they have it, which is similar to a lot of other countries. Every year, there are 34,800 new infections, although there has been a 9% decrease of infection from 2015 to 2019. This was affected with the ACA. Since people with pre-existing conditions are not denied health insurance, this means that people who have HIV are able to stay on their health insurance even though the disease may be pre-existing. Medicaid is also one of the biggest insurance coverages for people with HIV, since a higher percentage of people with HIV are below the poverty line. This means that the Medicaid expansion allowed for more people who are diagnosed with HIV to get care if the specific state allowed for the expansion. The ACA also emphasized the importance of preventive care like PrEP, frequent testing, and ART, antiviral therapy, for those who do develop HIV and stop it from becoming AIDS. Germany has one of Europe's lowest infection rates of HIV, with only 3,000 annually developing it, which compares to the US of 34,800. The German government's plan Don't Give AIDS a Chance focuses on prevention strategies like promoting condom use and increasing public knowledge of the risk of HIV, which is again very similar to the US. In Germany, everyone has to purchase statutory health insurance, which covers nearly all residents, and it only uses 11% of their GPD expenditure, and that compares to the US of 17.8%, a very drastic difference. Most of German healthcare is focused on primary care, and physicians use a global budget. Since nearly all residents have health insurance, most HIV treatments, like ART, are covered by health insurance. While these are covered by insurance, the wait times are usually generally longer, and only generic drugs are usually covered. This compares to the US healthcare system, since the US usually has shorter wait times for services, but it's more expensive. Germany's healthcare system also covers PrEP, but a physician must be certified as an HIV specialist in order for this medication to be covered by insurance. The statutory health insurance, which covers the majority of Germans, also covers HIV-related healthcare like HIV medications like ART and CART, which is combination antiviral therapy. The government decided to cover HIV-related health because we know that HIV is not a death sentence, which is due to the advances in medicine and knowledge about protecting ourselves from HIV. Due to this increase of information about HIV and how it is transmitted, there has been a decline in new HIV infections, similar to the US. And just like the US, this is due to pushing towards informing the public on how to protect themselves, again, like condoms and medications like PrEP. Also similar to the US, the normalization of the disease has removed a large amount of stigma on it, since anyone can get it, and as stated before, it is not a life sentence. Germany has also worked towards increasing testing centers and encouraging its citizens to get tested regularly, so many people don't know they have it, especially women. This is common everywhere. There are currently 140,000 adults and children living with HIV in Haiti, with 6,600 adults and children newly infected. This number is double the amount in Germany, but less than 5 times the amount in the US. Although in comparing to other Caribbean countries, Haiti has one of the higher prevalence rates. In the past, this was mostly due to poverty rates, which came with higher percentages of young girls developing HIV since they were encouraged to engage in sexual relationships with multiple older men. This creates lots of stigma surrounding the prevention and care, making it hard for people to seek treatment, especially since most people do not have regular access to a doctor or a primary specialist. This lack of structured healthcare is due to the inaccessibility of physicians, and half of patients do not have access to a primary doctor, unlike in Germany and the US. There was an earthquake in 2010 which limited the amount of hospitals available to Haitian residents, and Haiti only uses 4.8% of spending per capita compared to 11 and 17.8% in Germany and US respectively. In general, 80% of Haiti's population is below the poverty level and located in rural areas, those of which are more likely to not have access to healthcare. Haiti also does not have the same focus for prevention like the US or Germany, so there are not a lot of programs that try and educate the public on popular public health issues. Besides, the Plan Director Santé, which is a new public health program that increases the amount of physicians and strives towards increasing both knowledge about HIV and having people tested to have a more accurate number of who has it. Due to this plan, the amount of HIV-positive people who are being treated should increase from 75 to 95%. This plan would work towards increasing amounts of services and the percent of GDP spending, since 4.8% is very low compared to other countries with better healthcare, like Germany. The Abuja Declaration suggests that countries dedicate 15% to healthcare, which is more similar to Germany and the US. This will help patients have a more structured healthcare system like Germany and the US. Overall, all these countries have decreasing amounts of new HIV infections, mostly due to the increase of education, testing sites, and prevention measures like condoms and PrEP, and medications like ART and CART. These countries have also begun to destigmatize HIV and realize that HIV is not a death sentence. Thank you.